Okay, good evening, everybody. We are going to start the webinar today now. Okay, good evening, everyone, and welcome to the Gyaan Vardhini session number 27. I am Anand from ClinSav team, and I thank each one of you to join us today as we embark on yet another enlightening journey of wisdom and knowledge enhancement. Before we begin, I would like to share a brief overview of the amazing ClinSav app that we have developed over the last 6+ years. ClinSav means clinic savvy, and it is the only mobile-based clinic management app in India that allows you to manage your clinical practice in a full or 100% offline mode. It has a very simple design. ClinSav helps doctors easily manage patients, appointments, case papers, full prescriptions, bills, fees, issue of pre-fill letters, manage finances, and doing follow-ups with patients for any outstanding dues. ClinSav also sends automated appointment reminders 1 day in advance to your patients through SMS, and it also gives you the ability to simply swipe and send custom WhatsApp messages to your patients. Now we shall be starting with our today's webinar. Our today's webinar topic is aromatherapy and its clinical use in Ayurvedic practice. Our distinguished speaker for today is Dr. Kirti Deo. Dr. Kirti is an accomplished Ayurvedacharya with 27+ years of experience. She is an MD in Ayurveda, PG, Diploma in Skin Aesthetics, Trichology, and BA in Yoga Shastra. She has conceptualized and practiced Ayurvedic cosmetology since 2006. She has received various awards and recognitions, such as recognition from Ayurveda Vyaspeeth for work done during COVID-19 in 2021, second prize for Best Scientific Paper Presentation at International Seminar, Ayurved Parv, held by Ayurved Vyaspeeth at Nagpur in 2022, Arogya Seva Vritti Puraskar from Arogya Bharati, Konkan Prant in 2022. She is also an avid writer. She has been writing the fortnightly column Ayusho Veda Ayurveda in Mumbai Tarun Bharat newspaper since May 2013. More than 290 articles have been published till date. She is an editor of Ayurveda Prathomapchar book published by Ayurved Vyaspeeth and released in the presence of Dr. Sri Mohanji Bhagwat on 12th of November 2022. Her published articles cover various topics in Arogyam, Vaidyaraj, Ayurved, Hitashani, and other such health-related magazines. She has also edited Balrog and Twacha Vikar books for Ayurved Vyaspeeth Mumbai. Dr. Kirti Deo has manufacturing experience and formulations of wide range of authentic Ayurvedic cosmetic preparations for patients. More than 80 products based on Ayurvedic principles and concepts are available for Ayurvedic practitioners. Dr. Kirti has teaching experience in developing Swakrut Ayur cosmetology course modules based on self-research. She has been conducting certificate courses for BAMS graduates in Ayur cosmetology for basic and advanced since 2015. BAMS doctors from Maharashtra, Goa, Gujarat, Rajasthan, Madhya Pradesh, Karnataka, Tamil Nadu, Russia, Germany, and Sweden participated in these courses. As of date, 30+ batches have been conducted. She has conducted training programs and lectures for Ayush doctors at Thane Civil Hospital. She also designed and tutored Panchakarma course at Tulip International Mumbai. Dr. Kirti is the resource person for transitional curriculum or induction program for undergraduates and postgraduate students at various Ayurvedic colleges across Mumbai, Thane, and Ratnagiri. Panchakarma in Cosmetology at Clinical Panchakarma Workshop organized by Sayan Ayurved Mahavidyalaya, Mumbai, and resource person for add-on certificate course in Ayurvedic Cosmetology held under NAC by Ayurved Seva Sangh's Ayurved Mahavidyalaya, Nasik. On scientific presentations and as a speaker, Dr. Kirti was invited as a panelist and speaker at National Arogya Fair organized by Ministry of Ayush at New Delhi on topic of cosmetology and nutrition in Ayurveda. She was invited as a speaker at National Arogya Fair and AIAC Con 2024 at Thane on Ayurvedic medifacials, Potali facials. Dr. Kirti was a speaker at various online and offline programs, CMEs, courses, and seminars on different scientific like Jaloka in skin disorders, Shuchi Kurcha Kuttan Vidhi, Saundarya Chikitsetil Upayukta Kalpa, Dushtavrana, management of migraine, Anulom Akshay, use of Malhar Kalpana in Saundarya Chikitsa, Takra, Ayurvedic medifacials, hyperlipidemia and basti, anger management, insomnia, how to overcome anger and stress, Twacha Ani Agni Paraspar Sambandha, entrepreneurship in Ayurvedic cosmetology, my success story, etc., at various institutes and organizations across Maharashtra and other parts of India. Dr. Kirti, we are honored to have you with us today. To conduct this webinar, let us all welcome Dr. Kirti Deo to today's session. Dear ma'am, you can start.
Thank you very much. First and foremost, Dr. Anand Nanavati, Mr. Anand Nanavati, for this wonderful introduction. I thank Gyaan Vardhini, Dr. Hima, and Dr. Snehil, and the whole team for giving me a chance to present my presentation today. My journey in aromatherapy started way back in 2007 when I was working in an maternity hospital in Kalyan. There I used to get to see the Garbhinis who had nausea, who had backaches, who had melasma, but were little reluctant to take any internal medication. So, as a physician, I was wondering what all things can we do along with our therapy for local treatment. And that was when I got introduced to this wonderful journey in aromatherapy. And since then, I have been using various essential oils in my practice. Uh, Also, my self experience during my first pregnancy was I had nausea throughout my uh, three trimesters. So I was the guinea pig for the first usage of aroma oils or essential oils. I would say that. The essential oils have very pleasant smell. So naturally, it hides the smell which our specific bruiters and tailors have, and patients are a bit reluctant to use them for a longer duration of time. So it enhances acceptability of our product. That is one of the main reasons why I combine essential oils with our formulation. And yes, Ayurveda has evolved. We have seen the transition from churnas to churna capsules, from basti enemas to basti pouches. Even nowadays, we get grutas in the form of soft gel capsules. Even kvat we get in the form of kvat granules. So yes, if you change the formula, you don't actually change the formulation, but if you enhance it or fortify it with some other formulation, the results that we get is very good. And that is what happens when we start using aroma oil. So today's topics for today's presentation, these are the following topics I'll be sharing or I'll be discussing. So actually, what is aromatherapy that I'll be going into? What are Sugandhi Dravyas that are being mentioned in Ayurveda and how do we use it? We use it in our practice, but we don't know the range in which we use it, the ways to use various essential oils, the dosage, indications, and formulation. So let's start today's presentation. So actually, what is aromatherapy? As the name suggests, it is a therapy. So it is a treatment. So it literally means treatment of various human disorders through aroma. The aroma is sensed through smell. Okay. And this smell can not only influence our moods and thoughts, but it can also influence our sexual behavior, our cognition, our vigilance, our mental, spiritual, physical well being, and also health. So the range of action of aroma therapy or essential oils is very vast. In this, specific essential oils, which are of natural plant derived base, are used for to improve the health and well-being. So that is for Swasthya Rakshan and as well as for Vyadhi Parimuksha, we use these essential oils. I'll give you an example. Uh, I'll say a project or a trial was conducted in a company in Japan way back to see how the efficacy or the productivity of a group of office goers could be enhanced. So they use one basil oil ka vaporizer or diffuser in their office, and they got to see the 40% efficacy or productivity increased because of that essential oil. So such small experimentations are going on around the world. So we too can use such experiments in our own practice and flourish. So essential oils, as we can see here, they contain more than 100 chemical compounds, each having some or the other therapeutic properties. So those with aldehydes or those with alcohols have specific usage, specific action. So every chemical composition has a combination with one or two which are more in quantity or in concentration. Excuse me. So when used properly, it can prove very useful in many disorders and diseases by stimulating the natural defense and also by strengthening the system. So naturally, this is how even the Ayurvedic system of our practice works. It, the same philosophy is used in Ayurveda. So here we don't treat the Vyadhi, but we balance out dosha, dhatu and mala imbalance. So here too, while using essential oils, it strengthens the system. So many a times I feel while using aroma oils or essential oils that it is very close to Dravya Gun that is being explained in our Samhita. And many of the things are similar to that we use in our practice. So as we see here, these are few chemical components, and as per the composition, the action and efficacy changes. So here I'm giving few examples of what the main chemical component is, what the action is, and few of the examples. As you can see here, the essential oils which are monoterpene rich, they have anti-inflammatory, decongestant, antiseptic, antiviral, and antibacterial action. What does that mean? See, we have been using many a times lemon. आजकल तो विटामिन सी के लिए बताया भी जाता है कि सर्दी होगा तो विटामिन सी ले लो ताकि तो मेनी ऑफ देम यूज लेमन का जूस एंड दे ड्रिंक इट decongestant cough and cold relief. So something of that sort is being used in aromatherapy for many centuries, at least 100 or 200 years back. The essential oils are very concentrated and therefore they should not be used directly or that is the main caution that needs to be taken while using any sort of essential oil. It should not be applied directly. It is known as not to be applied neat. Neat is directly. It is always to be applied with some other sort of either oil or quath or fant or water, any other base, and to that a certain concentration, certain percentage of essential oil drops or ml in ml form needs to be added for the better results. When the essential oils have sesquiterpene in major composition, like in Roman chamomile, sandalwood, rose, or other floral oils, it has very good anti-inflammatory effect along with anti-allergic, antiviral, and antibacterial. So we know we ourselves use sandalwood wherever there is short. So here too they are telling the same thing. So as I said before, there are many similarities between the Dravya Gun in Ayurveda and essential oils in aromatherapy. When compounds are rich in phenols, it is antiseptic, disinfectant, and antibacterial in nature. But the percentage of dosage and the duration of the dosage needs to be checked because long-term usage can be toxic. It can cause skin and mucosal irritation. See, nowadays now, there is a boom in market where everyone is going for various perfumes, incense sticks, or some sort of aromas are used in each and every formulation. Excess of this can also trigger certain toxic reactions within the body. So you need to be very careful what and when you are using, in what quantity, in what context. Just for the smell, just for feeling good factor, it should not be used. After all, it is also medicine. See here in phenols also it is written cinnamon. I have seen this. Cinnamon is used in anti-melasma treatment. But when it is used for a longer duration or in a stronger concentration, even late when I give it to patients and I ask them to apply a very thin layer and wash it off or mix it with some other thing and then apply it. If the patient is over enthusiastic and if he or she applies it directly, sometimes skin irritation occurs. So it is always better to know the adverse effects or the side effects before telling whether it is feasible for the patient to use it. The next combinations that we see here are alcohols. So in these formulations, it is antiseptic, antiviral, antifungal. So in many infective conditions, these formulations can be used. These essential oils can be used. It has uplifting and energizing effect. There are few examples that I'll be sharing here. The lavender. In a brief or in a gist, I'll tell how aromatherapy came into existence. It was discovered by R.M. Gattefoss. He was a French chemist and he was working in his lab. He is known as the father of aromatherapy and he also coined the word aromatherapy. Till then, it was just some perfumes or just scents or fragrances used for various usages, but he used for therapeutic use, and hence he is known as the R.M. Gattefoss is known as the father of aromatherapy. So while working in his lab, his hand got scalded, burnt, and instead of putting it in a water bath, he put in a lavender bath. So lavender bath doesn't mean only lavender oil in it; it means water with lavender in it. And miraculously his hand uh, cleared or wound healed very miraculously very early. So that is how he got to see the therapeutic use and then he started researching on it and that is how aromatherapy came into existence. So likewise there are certain medicines that are very useful but it should be used in certain formula combinations and concentrations. Here again, aldehydes can cause skin irritation and sensitivity. Few of the examples. These are not the only examples. There are many more essential oils, but just these are some of the commonest essential oils that are used in the market, and hence I have given these examples. The ketones have mucolytic action. So naturally eucalyptus, we use eucalyptus. घर घर में होता है. We use it in drop form on a handkerchief and ask the patient to smell it. So this is also type of aromatherapy. We just don't label it as aromatherapy, but that is what we do. So
Excuse me,
mucolytic,
ma'am.
yeah,
Yes. Can you put the slides on slideshow mode, ma'am?
yeah, I'll do that. Is it okay?
Yes, better, ma'am. Thank you, ma'am.
Yeah, okay. So here, as we can see, the mucolytic action of ketones, we use eucalyptus or we use peppermint in many of the combinations, and it also has skin regeneration. So frankincense is used for anti-aging. Even wherever there is wound healing process required, even there, frankincense, peppermint, rosemary, all these formulations are used. The next set that we see are the esters, ethers, and naphthalene. So here, as you can see, esters are sedative. It has very mild fragrance. Manda sugandha जैसे बोला जाता है. It has that, and it has sedative effect. See, the previous slide showed lavender. Is my cursor visible?
Yes, ma'am.
Okay, thank you. So here in this slide, we have seen that lavender has energizing effect. And in the next slide, I'm showing that lavender has sedative action because lavender has esters as well as alkaline. So each combination or each essential oil is not made up of only single chemical component, but it is a combination of more than 5 to 6 major chemical components. So naturally, it will also have multiple actions. So single action for a single drug ऐसा नहीं होता है. It can be used in various formulations. Just we need to find the right combination for the right action. Okay? So here esters are used for as sedatives. The second is ethers. See, even basil का ना हम लोग जब बताते हैं when we ask the patient to have tulsi and basil are from the same species. Okay, though the Latin name is different, a bit different, but they are from the same species. So basil या tulsi, whenever we ask the patient to consume it, we ask them to have only 2 or 3 leaves. Why? The reason being when they have it in excess, it causes teeth enamel erosion. So excess use of basil or excess use of tulsi is also not advised. Similarly, even aroma oil therapy as well, it is neurotoxic and hence for shorter duration and in lower concentration, it is recommended. The combinations or the essential oils that have lactones can be skin irritant and sensitized, can cause skin sensitization. What does that mean? That means whenever it is applied on the area and if skin becomes sensitive to that, any component which has these essential oils, skin will give out the rash. That shows it is not compatible to that skin. So whenever you are using any sort of essential oils, uh, uh, there should always be a precautionary measure that a patch test is to be done. So for any essential oil formulation that you are using for the body, a patch test can be done at the elbow area, at the inside of your elbow region. Apply the formulation, keep it for at least half an hour or can be kept overnight. If there is any eruption, if there is any itching, if there is any irritation or redness, it is not suitable for that skin or for that person and you can discontinue it. But if for the face you are giving any formulation, ask the patch test to be done at the jaw, below the ear, near the jaw. Keep it overnight, or it can be done even at the back of the ear if the patient is very sensitive. But always do a patch test before using essential oil. That is required. Even wrong choice of oils along with excess sun exposure. There are certain citric oils like lemon, yeah, orange, yeah, neroli, yeah, petit grain. There are multiple essential oils of citrus family. If they are used during sunlight or during daytime and if exposed to the sun, they are photosensitive. So they can cause eruptions or rash on the skin. So we don't know such things. We just won't apply. Many of the deo sprays we use have essential oils of citrus family. Patient apply it, spray on the body, and they go out. After certain duration of time, because of photosensitivity, skin starts burning, skin starts becoming darker, or some of the other problem sets in. So choosing the oil right, avoiding the sun exposure, and avoiding excess amount of usage. These 3 factors needs to be taken into consideration while applying any of the essential oils. So this is the base. What all things can be used? See, essential oils, as I said, according to Dravya Gun. Dravya Gun, maybe we use Panchanga, sometimes we use only Patra, sometimes we use only Mool roots. So here too, there are various essential oils prepared from different plants. Essential oils are completely from plants. It is not, this is natural plant-based oils. Those are known as essential oils. A little slight difference is there between aroma oils and essential oils. So essential oils are necessarily plant-based natural oils, whereas aroma oils can be prepared in lab. They can be synthetic. So when we talk about aromatherapy, it is using essential oils and not using aroma oils. This little difference that we need to always keep in mind. Essential oils again are not available in each and every plant. There are certain plants, those who have these volatile compounds, only from there can we get these essential oils, not from all the plants, and again from certain parts of the plant. For example, there are certain parts, flowers, certain plants whose flowers have essential oils like rose, lavender, or chamomile. Some of the fruits like pepper, juniper, lemon, those have essential oils. Some have essential oils in their leaves, and some have in the woods. Woods means in the bark or in the roots. So bark में से जो resin निकलता है, that is also considered as an essential oil. So this is the wide range of essential oils that are available from the nature. According to Rudolf Skinner, he way back in early 1900s, he suggested that certain parts of essential oils derived from certain parts of the tree have certain specific usage. For example, flowers, fruits, and seeds like rose, lavender, or juniper, pepper. All these they interact better with metabolic system, and therefore they are more useful in problems or disorders related to digestion, assimilation, excretion and reproduction. तो वी नो पेपर हम लोग देते ही है, त्रिकटु तो होता ही है, या फिर लेमन पाचक के लिए हम लोग यूज करते हैं. So while learning going into depth of essential oils, I always found many similarities between Dravya Gun and essential oils. Foliage yani leaves. So here leaves interact with the rhythmic system of our body. So respiratory system and circulatory system, ये दोनों के जो problems होते हैं, using essential oils prepared from the foliage are better. The roots, even ginger as seen here. So these are useful when used in certain specific systemic disorders. Roots interact with neurosensory systems and has a beneficial effect on the brain and nervous system. What is being said or what do we know from our text that we will see briefly? In Ayurveda, Sugandhi Dravyas are mentioned in all the three Bruhatrayis. I'll restrict only to Bruhatrayi for today's presentation. The Gandha Gun is an inherent component of Sugandha. It is inbuilt in that. Sugandha, Sugandhi Dravyas are enriched with Sugandhi Dravyas naturally have too much of Gandha in it, and therefore it influences both Sharir and Manas, and hence are useful in Sharir and Manas Swasthya. So for Swasthya Rakshan also and for Vyadhi Parimoksha also, for both Sugandhi Dravyas are referred or explained in our Samhita. Sugandha, as the names here in Amarkot, there are various synonyms given for Sugandhi Dravyas like Ghrana Tarpan. As the name suggests, it has nutritive action on Ghanendriya. So the path through which it enters the body, उसे भी वो तृप्त करता है, उसकी तृप्ति या तुष्टि करता है, and then it enters. So tarpan karya is done of Ghanendriya as well. Surabhi means pleasant or pleasant in nature or agreeable. That smell which soothes your body, soothes your mind, calms your mind. That is Surabhi. And Ishtagandha is mononucal. Mononucal यानी सभी को, for example, see, we all use perfumes, but not everybody likes a specific the same perfume. Some might like citrus, some might like floral, some might like very strong perfumes. The combination varies. So Ishtagandha here means which provides mental well-being, a calmness, and that which has therapeutic and aromatic and comforting smell. So it has therapeutic use as well as comforting use. That is what Ishtagandha means here. So we know Gandha. Gandha is the Nasa is Adhishtan for Gandha. Since Nasa is Shirosodvaram, it enters our body through Shir via Nasa. It directly, because of that, reaches our brain and nervous system along with that limbic system. So limbic system is the area where our emotions are present. So it affects our emotions immediately. एखादा, if you're traveling and if you get very, for example, Parla के नजदीक, you get very good Parle जी का. It used to be there. I'm not sure if it is still there. Parle जी biscuits का smell आता था. या फिर थाना में कैडबरी के यहाँ जाते तो कैडबरी जंक्शन के यहाँ पे कैडबरी का स्मेल आता था. So it was very pleasant. Just by traveling through there, बहुत अच्छा फील होता था. During my younger days, मतलब बचपन में, I used to go to a baby crèche where the floor was wiped with Dettol water daily, at least twice. Okay, so that is a bachpan ka smell still in my built up memory. So whenever I smell a Dettol smell in the uh, any household, I feel very relaxed. So we also have memories of previous essential oils or smells because it enters our nasa, goes into our nervous system, along with that into limbic system where our emotions are there, and it gets attached to that. So naturally, ekhada smell, if it is connected to a certain person, so you will naturally feel if you like the person, you will have good memories. If you don't like the person, you will have bad memories just by smelling that smell again in the near future. This sugandha or this smell, even in small doses, proves very potent. So I had this. I'll just give one example. When I conduct this process, I teach aromatherapy, though not so much in detail, but thoda sa sikhati hu. So I was having this session on aromatherapy and I was giving the participants the smell of each and every oil that I use. And I had specifically asked all the participants to थोड़ा सा ही स्मेल लेना, बहुत लंबा सांस लेके घूमना नहीं. But there was one doctor who did that because she liked the smell. बहुत अच्छा है, बहुत अच्छा है. So she एक 4 5 10 smells का smell बहुत लंबे लंबे लिया and she started feeling giddy. So she was very restless. वो कहीं पे बैठ ही नहीं पा रही थी. She left that day early and मतलब इतना सा सिर्फ स्मेल से क्या हो सकता है. So this is what can happen. This I have seen in my practice. So yes, potent है तो उसको यूसेज उसका बहुत be very careful when you use it. And according to the Sugandhi Dravya, its action can be it can differ on it can have action on various different neurotransmitters such as acetylcholine, noradrenaline, serotonin, etc., and give out this similar uh, impact or efficacy. Then these Sugandhi Dravyas are known as Saumanasya Janak in Sushruta Samhita. Saumanasya is Sumanaskata. So that Saumanas means improving quality of मन with pleasant aromas. तो बहुत अगर अच्छा स्मेल होगा ना तो चिड़चिड़ापन भी निकल जाता है. सुमनस तो एक what should I say, कामनेस और एक शांत शांतता आ जाती है. सुगंधित द्रव्य का जो है they are also sarvagandha. These are all references from Sushrut Charak. You can also go through it. Sugandha is Sukshma Guni, Mrudu Guni, and Sukhanubandhi. This is what Ashtanga Hridaya has said in Chikitsastan Adhyay 6. So, what is Sukhanubandhi? Sukhanubandhi is Sukhajanak. And Sugandha, the word Sugandha means Shobhana Gandha Yasyaha. So, that that which is endeavored or is which has pleasant smell as its nature is Sugandha. And because of Sukshma Gun and Mrudu Gun, it enters immediately. As we said, nervous system, it also, according to Ayurveda, it enters into the Manohar Srotas and is expressed in the terms of Kaya, Vak, and Mana Karma. That is, Sharir, Vak, and Mano, Tarpan, and Tushti. That is what is said in Ashtanga. So the action is not only on physical body, but on emotional and mental aspect of the human being as well. So Sugandha plays very vital role in treating the patient. For example, if a patient comes with lower back pain, he is very depressed. Your oils, your treatments will help. Internal medicines will help. But to boost his or her chitta or sattva, also a few essential oils will help immediately. Gandha gun is one of the Vinshati guns that we have read in Ashtanga Hridaya. So Guru Manda, Hima Snigdha, Lakshma Sandra, Mrudu Sthira, Sukshma and Visar. These and opposite are the 20 gunas that are expressed by Ashtanga Hridaya. Along with that, Sushrutaracharya has given 5 more Dravyashrit gunas, of which Sugandha is one. The other 4 being Vyavai, Vikasi, Ashukari, and Durgandha. The karma occurs because of Dravya. So this guna of Gandha gun is Gandha is Prithvi Mahabhut Pradhan, and therefore whichever Parthiv Dravya is there, it will definitely have Gandha. पार्थिव द्रव्य के कर्म जो है इट इज गुरु खर कठिन मंद स्थिर विशद सांद्र स्थूल these are all the gunas of gandha of parthiv dravyas, and those are found in madhur ras because it is ishat kashay and prayosho madhu. Therefore swadhu anna is considered somanasya jana. See, it is also interrelated, interlinked कि we never think कि सुगंध भी इतना far fetched action कर सकता है, but it is all given in our Sanhitas as well. So sumanas means a calmness or peaceful state of mind which is required at various stages of life in each and every human being. Saumanasyam balam pushti utsaham harshanam sukham. So these are the properties of Saumanasya that is said in Sushrut Samhita Sutrastan Adhyay 46. Thus, whatever Swadhu Anya, Madhur Rasatmak Anna is there, it all have Rudya effect. And hence we use Sugandhi Dravyas in various treatments in Dinacharya, in Ritucharya. I'll give few examples here. So here we have seen Gandha, Maladharan. This is all explained in Dinacharya. The Sugandhi Dravyas in the form of lep, aha, or har, or even an incense stick, udbatti or dhoop or whatever, it brings one to a peace and tranquility. If one puts gajra, वो स्मेल से भी बहुत ठंडा ठंडक लगती है. या फिर अभी जैसे गर्मी आ जाएगी, उशीर वाया का वो जो पर्दा बोलते कर्टन होता है, that smell also is very pleasant and very calming. Even this type of parda or curtain or lep or mala, these all are explained even in Vasanta and Grishma Rutucharya. Sugandhi dravyas are also used in dhupan. Dhupan in what all senses, naturally दिनचर्या में तो है, बट अलॉन्ग विद दैट उसमें फ्यूमिगेशन फॉर दूषित वायु ये ट्रीटमेंट में बताया है. तो दूषित वायु जनपद ध्वंस में उन्होंने बताया यू कैन फ्यूमिगेट यूजिंग सुगंधी द्रव्य और अ पेडियाट्रिक वार्ड और अ सुगंधी शैया, बच्चों का जो रूम होगा या सोने की शैया होगी उसको भी सुगंधी द्रव्य से धूपन करो. दैट इज व्हाट इज एक्सप्लेन. सो दिस ऑल आर द रेफरेंसेस फ्रॉम बृहत्रयी. Along with that, to prevent contamination and to prevent infestation, even the कोठार यानी ड्रग स्टोर या फिर कंटेनर्स उनको भी धूपन चिकित्सा बताइए. So these are all preventive aspects mentioned in Sanhita. Along with that, even तैल सिद्धि, the last process, मूर्छन के बाद सिद्धि के बाद the last process is in the तैल सिद्धि is गंध. तो गंध के लिए भी वो पोटली बना के इट इज केप्ट इन वार्म ऑयल इन अ सस्पेंडेड फॉर्म. So likewise, there are multiple usage for Sugandhi Dravyas in Ayurveda. One more example I'll be giving is about Pittaj Upakram. In various Pittaj Upakram, now we'll be going into summer. So these are few Upakrams that are explained in Ayurveda. Here, Sugandhi, Shita and Priya Gandhi, those are the gandhas that need to be safe. उसका सेवन करना चाहिए. That is what Ayurveda says. For Vrana Dhupan also, to dry out the Vran is one of the aspects, to heal the Vran earlier, and to cover the foul smell coming from the Vran. ये तीनों actions के लिए Vrana Dhupan बताया है. This third option, Vaman Uddipan. See, Vaman के उद्युक्त करने के लिए there is no pleasant smell, but उग्र गंध. इन चरक कल्पस्थान देर इज दिस जीमू तक और इश्वाकू का बताया है. उनके फ्लावर्स का, ड्राइड फ्लावर्स का गार्लैंड पे पाउडर छिड़क दो और वो स्प्रे से ही वमन उद्युक्त हो जाता है. तो बच्चों में देने के लिए दिस इज वन टाइप ऑफ वमन का ऑप्शन दैट कैन बी यूज. या फिर सदवृत्त के लिए जो सदवृत्त अनुष्ठान के लिए जो बताया है Here in Charak Sutrasthan, Adhyay 8, inhaling of pleasant odors और pleasant aromas, उससे ही मानसिक स्वास्थ्य मेंटेन हो जाता है. तो बहुत एंशियस है, बहुत डिप्रेस है, बहुत चंचल है, कामनेस नहीं है, अस्थिरता है, ऐसे सब में सद्वृत्तों को अनुवर्तन करने के लिए, that is what Ayurveda has said, कि you can have inhale pleasant good odor to maintain मानसिक स्वास्थ्य and improve functioning of the mind. दुख शुद्धि के लिए बताया है. मल्टीपल ऑप्शंस. हाउ डज दे एक्ट? बिकॉज दे enter the nasal route via Pana Marma and Shringatak Marma, which both these marmas have rich neural and muscular connections, and therefore they reach into the various areas of the body very easily. तो ये देखने के बाद नाउ वी विल गो हाउ टू यूज एसेंशियल ऑयल्स. एसेंशियल ऑयल्स के अलग अलग रूट होते हैं. दिस आर द मेजर थ्री. सी वेयर आई लर्न ऐसे अरोमा थेरेपी, वहां पे हमारे गुरु ने बताया था कि यू शुड नेवर यूज अरोमा ऑयल्स फॉर इंजेक्शन, फॉर इंटरनल यूसेज. देयर माइट बी सम who profess using it, but I don't use it in my practice and I don't recommend it in to anybody. But what we can do is we can use it as a application in various forms. कैसे हो सकता है? So it can be used directly on the skin, directly यानी through massages, through compresses, through baths, through showers. I'll give the examples in the later slide. इनहेलेशन थ्रू लंग्स, डायरेक्ट भाप जो लेते हैं, सर्दी हुए तो हम लोग स्टीम लेते हैं, इनहेलेशन करते हैं, वेपोराइजर से करते हैं. तो दोज आर दी थिंग्स डायरेक्ट हो जाता है. Olfactory system, I'll give one example. When we go to malls, in the restrooms they have this बड़ा बड़ा diffusers they have kept, और उसमें से certain citric smell आते रहता है. तो बड़े एरिया में वो स्मेल घूमते रहता है. सो यू गेट द स्मेल्स ऑफ मेनी अदर स्मेल्स ऑल्सो अलॉन्ग विद दैट, ये भी स्मेल रीच होता है. So this is the difference between second and third, inhalation through lungs and inhalation through olfactory system. So what does actually happen here? Here a penetration that is said, as you can see, first is abhyanga. So abhyanga can be sarvanga, it can be ekanga, it can be padabhyanga, it can be shirobhyanga, it can be mukhabhyanga. So in various abhyangas, you can add essential oils to your formulation. तो यहाँ पे क्या होता है? Touch therapy. Touch therapy is one of the most fundamental means of communication. So whenever someone is stressed, if you give little bit of head massage, if someone is suffering from insomnia, if you give little bit of padabhyanga, or if someone is very stressed out, थोड़ा सा neck muscles, shoulder muscles, थोड़ा सा upper back को massage कर दिया, patient relaxes like anything. Excuse me, just according to Madam Margaret, essential oils could quickly be absorbed through skin and be effective. So easiest mode of uh, uh, essential oils to enter into your system is through massages. Even we know, according to Ayurveda, Bhajak Pitta ki wajah se whatever you apply on the skin gets absorbed into the skin very easily, very quickly. And since our skin is lipophilic in nature, अगर oil format में होगा तो absorption ज्यादा अच्छा. So naturally massage करते वक्त अगर if you are using essential oils in the formulation with your Siddha telas, you will get better results. It relaxes and makes one feel very comfortable. Along with that, improves blood circulation, it tones the muscles, detoxifies the toxins, it releases trapped energy from the muscles, and overall relaxation दे जाता है. Compresses can be hot as well as cold. हमने बचपन से देखा है, अगर बुखार आया है तो पट्टी माथे पे लगाते हैं, अगर मेंस्ट्रुअल क्रैम्प्स रहेगा तो लोअर एब्डोमेन पे गरम पट्टी लगाते हैं. So this is what we do on a daily basis also. Along with this, cold compresses can prove useful in strains. जब hot and cold compresses बताया जाता है, तो एज आई सेड प्रीवियसली कि रक्त चंदन तो हम लोग यूज करते हैं, उसके भी सैंडलवुड के भी ड्रॉप्स मिल जाते हैं. तो इफ यू एड दैट एंड देन यू लेट, तो नेचुरली उसके इम्पैक्ट ज्यादा अच्छा आता है. तो यूजफुल इन स्प्रेन्स, फीवर. फीवर के लिए भी कफ के साथ होगा तो कॉम्बिनेशन थोड़ा अलग आएगा, या लवेंडर, पेपरमिंट, रोजमेरी, ये ड्रॉप्स हम लोग यूज कर सकते हैं। तो फीवर, हेडेक, टायर्डनेस, फटीग, इंसोम्निया, इवन जेट लैग, जब जेट लैग की वजह से बहुत हैंगओवर रहता है, उसमें भी एसेंशियल ऑयल्स का ये कोल्ड कंप्रेसेस बहुत यूजफुल हो जाता है। इट हेल्प्स रिलैक्स एंड इवन इंक्रीज बॉडी टेम्परेचर होगा तब पादाभ्यंग, जैसे हम लोग पादाभ्यंग के वक्त फर्स्ट स्टेप में जैसे पानी में पैर डुबोने को बताते हैं, एज इन स्पास दे डू इट, कि पेडिक्योर करने के पहले एज दे मेक द पर्सन इमर्स the feet into cold or hot water. Here we can make them use cold water when the body is too heated. So these are few ways how we can use cold compresses. Hot compresses, yes, menstrual pain as I said earlier. Even in boys तो उनको जल्दी पकने के लिए so that वो ooze out हो जाए ऐसे के लिए भी गर्म hot compresses can be used. Along with that for constipation, seeds bath अगर देते हो for piles or anything, उसमें भी seeds bath में along with triphala quash, these oil drops can be added, essential oil drops can be added. For stiffness के लिए hot compresses prove more useful, and for easing of pain, any sort of pain, for easing that hot compresses are useful. Along with that, we can also give tub baths. Tub baths में you don't waste water, but showers या जैकुजी होगा तो उसमें naturally water wastage ज्यादा होता है। तो अगर बेदिंग है और टब बाथ है तो उसमें आप 20 मिनट्स अगर सोक होते हैं तो एब्जॉर्प्शन एट इट्स बेस्ट हो जाता है। So essential oils peripheral blood system में reach करके they enter the interstitial fluid around the body cells and tissues and they work. So knotted या sprained या बहुत coiled up energy को relax करने के लिए absorption बहुत अच्छे से हो जाता है. It gives refreshing, relaxing and stimulating effect. Soaking helps actually relaxation के लिए ज्यादा help करता है. The next in the line is inhalation through lungs. तो inhalation करने के लिए as the first picture shows, it is for steam. We have used in COVID times. Everybody has done steam inhalation. पर अगर उसमें एक आधा ड्रॉप यूकैलिप्टस का डालते हो, एक आधा ड्रॉप अगर ओवा अर्क का डालते हो तो डेफिनेटली उसके रिजल्ट ज्यादा अच्छे मिलते हैं. या ब्लैक पेपर का एक आधा ड्रॉप, नॉट मोर, ओनली वन ड्रॉप बिकॉज इट इज वेरी पोटेंट. तो यहाँ पे फ्यू ड्रॉप्स लिखा है पर तीक्ष्णता देख के भी वी कैन एडजस्ट द ड्रॉप. So few drops in a bowl of hot boiling water अगर स्मेल लेते हैं तो it can help in cough, cold, sinusitis, throat congestion, etc. This helps air while breathing, it reaches into our lungs and the entire body system. So naturally it helps. जब inhalation on handkerchief है यहाँ पे बताया, this is not to be used directly. यहाँ पे जो oil bottle बताया है, it has a formula oil. It is not a single essential oil. तो पुटिंग 2 to 3 drops and on handkerchief और पूरा दिन उसका थोड़ा थोड़ा स्मेल ले सकते हैं. If not handkerchief, it can be used on a tissue, it can be used on a paper, it can be used for cough, cold, for stuffy nose, it can be used for relaxation. अभी 10th 12th के एग्जाम चल रहे हैं, बहुत सारा स्ट्रेस होता है, to reduce that also this can be used. This can be used for insomnia, to reduce anxiety, to reduce restlessness, to reduce negative thought process, to better or improve concentration. ये सब के लिए this way of usage can be done. Here direct smelling sunghana बताया है, but as I said it is not a concentrated essential oil, it is a formula oil and therefore it can be as inhaled directly. Otherwise, put drops on a cotton ball or handkerchief and then take the aroma. ड्रॉपलेट्स थोड़े से टॉवेल पे या क्लॉथ पे डाल दें. Steam inhalation या vaporizer, all for diffuser, all these things it can be used to clear the flame it is useful for respiratory tract infection. इवन रोल ऑन या रबॉन जो विक्स वेपोरब जैसा यूज किया जाता है, इट हैज पेपरमिंट इन इट, तो नेचुरली उससे वहां के फ्लेम यानी कफ निकल जाता है, ओपन अप हो जाता है, पैसेज स्टफिनस कम हो जाता है. You can prepare some formulations in your own practice as well. So vaporizers and diffusers, here the first is aroma lamp, जिसमें ऊपर की तरफ the upper part is little shallow. You can put water and few aroma or drops, essential oil का drops, and here there's wax candle. So wax candle से जितना गर्मी मिल जाता है, it heats up this water and this water evaporates, and by evaporation the aroma oils also evaporates and get completely spreaded into the area. This is the diffuser, aroma diffusers that we get in the market. Here again, यहाँ पे नीचे base में you can put the aroma oils, and this is the vapor that comes out and it diffuses into the complete room. So this is how it can be used for various infections, especially respiratory tract infections. Since it is very volatile in nature, this can be used for aroma purposes. It can be used as a mosquito repellent. It can be used before going to sleep. It can be used for before going to. मतलब रूम में you can create a माहौल, you can create a effect कि बच्चा पढ़ने के लिए उसके स्टडी रूम में जा रहा है, तो you can put on a vaporizer prior, make the room study friendly, and then ask the child to sit. तो उससे naturally concentration बढ़ जाएगा. Similarly, for the meditation, see, many a times what people do, they close the curtains, incense stick लगा देते हैं, and then they do meditation because that has calming effect. If you add vaporizer to it, you will get better results. That is how you can create a mahol or an environment. And this indirect smell is along with others. As I said, कि room में लगा दिया है, and along with other smells, you also get this. तो अगर पूजा कर रहे हो तो इन दैट पूजा का रूम इंसेंस स्टिक का भी स्मेल होगा, जो दिया लगाया है शायद उसमें अगर कर्पूर होगा तो उसका भी स्मेल होगा, हार डाला है जास्मिन का होगा, मोगरे का होगा, उसका भी स्मेल होगा. तो अलॉन्ग विथ मेनी स्मेल्स इसका भी स्मेल यू इनहेल. So that is indirect way of smelling through olfactory system. इससे भी it enters the limbic system of the brain, एंड इमोशंस, मेमोरी, मोटिवेशन एंड रिप्रोडक्शन सबके लिए उसको उसका इम्पैक्ट है. This limbic system consists of four parts, that is amygdala, hippocampus, hypothalamus and thalamus. So धूप, incense sticks, candles, deo sprays, room fresheners, toilet cleansers, everything cleaners, everything comes under this type of inhalation. this this is known as potpourri. तो यहाँ पे क्या किया जाता है, dried petals of various formulations are put into a bag which is porous in nature and then kept in a cupboard, से cupboard में रख दिया, drawer में रख दिया, wherever. जैसे नेफ्थलिन बॉल्स रखे जाते थे ना, वैसे ही एरोमा पाउचेस या एरोमा सैशेस या एरोमा पॉकेट्स ये सब रखे जाते हैं. So how to use, अभी इतना सब तो देखने के बाद how actually do we use it? See, on an average, na, this is a generalized way of using aroma oils or essential oils. Here, CO means carrier oil. So, this is the percentage 1 to 1.5% of essential oil. So, अगर 100 ml आपने carrier oil लिया है, तो 1 to 1.5% of essential oil. That is the formula or that is the percentage that is recommended for face, neck, sensitive parts of the body. एंड इसी के साथ दूसरा क्या है, इफ इट इज 50 ml, so here directly number of drops लिखे हुए हैं. तो 10 to 15 drops in 50 ml of any carrier oil, or it can be gel, it can be lotion, it can be water, it can be quartz, it can be fan, whatever carrier options you are looking at, उसमें इतने ड्रॉप डालेंगे तो you can use it for this type of application. So here everything is written down. 1 ml actually on an average contains 20 drops. So 5 ml contains 100 drops. So 1 teaspoon has 100 drops of essential oil. This is on an average calculation. So averagely for 1 teaspoon of carrier oil or carrier format uh, combination, 2 drops of essential oils are recommended. अगर कुछ बहुत सारे नहीं है, you are trying with 1 or 2, वैसे आप start करो. In a teaspoon, add 2 drops of essential oil and then start using. So essential oils should be kept or preserved in amber color direct glass jars. It should not be kept in metal. It can be kept in plastic, but over the period plastic भी shrink होना शुरू हो जाता है. If it is kept in amber colored glass bottles away from sunlight, उसका efficacy या उसका action longer duration के लिए मिलता है. In a single formula, this is one of the main slides I will say. In a single formula, you can use maximum of 5 different essential oils, not more than that. Keep that in mind. And selection of oil and its dose is very important for any formula when route of administration is key. So whenever you are giving it for application, always do a patch test till you are still doing trial and error. Once you get a knack of it, you can directly start using it. On an average, 15 drops as written here, 15 drops of essential oils for adults, and for youngsters, for kids from 2 to 10 years of age, 8 to 9 drops for the same quantity. So 8 to 9 drops of essential oils and 50 ml of carrier oil. That is what is recommended. For body and hair in general, so second and third point के लिए on an average 35 drops for adults and उससे half for 2 to 10 years. ये on an average ratio हर बार याद रखना. If you are using it for hair rinsing, any formula, whatever you are using, be it in a tripla kvath, be it in a panchakalkal kvath, oily scalp के लिए लोध्रब use किया है, whatever kvath या font you are using, in that वो font जो बनाओगे उसमें आप 6 to 8 drops use कर सकते हो essential oils, then that can be used for a single last hair rinse. So this is how essential oils can be used. तो एसेंशियल ऑयल्स आर बेसिकली ओडोरिफेरस, मतलब उनका एक्शन जो होता है दैट इज थ्रू दी ओडर और द स्मेल, एंड दे आर वेरी एक्सट्रीमली वोलेटाइल. तो नेचुरली वो ऑयली कंसिस्टेंसी के होने के बावजूद डायरेक्टली उड़नशील तत्व जो है वोलेटाइल होने की वजह से दे इवापोरेट वेरी फास्ट, एंड ये इवापोरेशन की वजह से इट हैज वेरियस एक्शंस, इंडिकेशंस उनके डिफर हो जाते हैं. The clear liquid, जैसे as I said, if it is from leaves or if it is from the flowers, it is generally clear liquid. But if it is from roots or bark, resin होगा तो वो थोड़ा सा sticky हो सकता है, colored हो सकता है, dark हो सकता है, resinous थोड़ा सा sticky material हो सकता है. And with heat and passage of time, the consistency and color change हो सकता है. So if you are making a bulk formula, chances are that if you are keeping it for longer duration of period, उसका स्मेल धीरे धीरे कम हो सकता है. अगर स्मेल कम है तो नेचुरली शायद उसका एफिकेसी भी कम हो सकता है. यू नीड टू कीप दैट इन माइंड. And essential oils have stimulating effect on not only circulation, but it also helps increase endogenous secretions like bile, various hormones. It helps in increasing the release of endorphins that helps combat depression. तो स्टिमुलेटिंग इन व्हाट वे, तो नेचुरली डाइजेशन के लिए भी स्टिमुलेशन है, मेंटली अगर फटीग है तो उसके लिए भी स्टिमुलेटिंग है, डिप्रेशन है तो भी स्टिमुलेटिंग है. जस्ट कीप इन माइंड कि अगर बहुत डिप्रेशन है तो उसको एकदम से स्टिमुलेटिंग नहीं करना है, वी नीड टू बैलेंस इट. तो पहले टू ब्रिंग इट आउट फ्रॉम डिप्रेशन, उसको बैलेंस आउट करके उसको नॉर्मलाइज करना है, एंड देन उसको स्टिमुलेट करना है. सो दिस 3 इंडिकेशंस बेसिकली आर रिक्वायर्ड. डे फॉर्मूला, नाइट फॉर्मूला, डे एंड नाइट फॉर्मूला में कि stimulating generally is a day formula, whereas sedative or subduing formula is the night formula. And to balance your formula, a balancing essential oil is required. So these are the formulations. These are few of the essential oils. इससे बहुत ज़्यादा formulations है. But these are few of the essential oils that I have written here, which have this stimulating and balancing effect. Always keep in mind कि whenever you are using lemon or any other sort of citric oils in stimulating formula, ask the patient not to go out in sun after immediately applying this essential oil formula. They can wait for half an hour, tap the excess of oil and then go up. It should not be used directly. If they are using any uh, sunscreen with uh, citrus smell, it can also cause tanning. So, if a person comes to you, always ask what all products the person is using, what all formulations have these scents and fragrances. Those scents and fragrances are bit different than essential oils, but that can also cause harm to the skin. So, knowing this helps us in knowing what the patient is actually consuming in the sense of application. Okay. So here are few of the formulations. You can take screenshots if you require. So these are few of the purposes for cough. There are so many formulations. Of this, you can use maximum of 5 essential oils in any of your formulation combination. So अगर सहचर तेल है, तो सहचर तेल में you can use some of these formulations and give for rubbing. Sore throat है, अगर खराश है तो गार्गलिंग के लिए देना है तो लेमन, यस वी कैन गिव लेमन, वी कैन गिव टी ट्री बट नॉट बियॉन्ड दैट. जिंजर का पाउडर दे सकते हैं. कोल्ड एंड इसके लिए घूमने के लिए यस, एप्लीकेशन के लिए यस, ड्राई कफ में स्मेल के लिए यस. So these are few of the essential oils that can be used for aches and pains. Yes, multiple of formulations we can make using this, but a care should be taken कि एक teaspoon में only 2 drops of essential oils and any 5 at the maximum is 5, not more than that. There is one essential oil known as Melissa. जब Melissa use होता है, one should know that Melissa is considered equivalent to 2 essential oils. And hence, when you are using Melissa, only three other essential oils can be used, not the fourth one. So these are few do's and don'ts that are there in essential oil usage in aromatherapy. For painful periods, yes, agar if you are giving hot compresses, if you are doing oil massages, you can use these formulations and give the patient. For swelling and inflammation, formulations are given. For colic and colitis, yes. Even nowadays, there's too much of viral where patient is undergoing or complaining of sore throat, of cough, and stomach pain. So combining few essential oils and asking them for application in our oil base gives very good results. These are few more: pigmentation, anti-aging, for stress, for tension, for uplifting. You can take screenshots if required. These are few more. We get a person or a patient coming to us is not only does not come only for physical relief or physical ailment. Many of the diseases are psychosomatic in nature, as we all know, and hence treating this psych along with soma is required. And thus, चिड़चिड़ापन, panic attack, anxiety attack, or insomnia due to pain, or any of such things can be there. And because of that, if you treat this just by application and do your medicine for internal usage, you get better results in shorter duration of time. So how can we combine it with carrier oils that we use? So yes, there are various other oils also like olive oil or almond oil or coconut oil or sesame oil, avocado oil. There are gels, there are lotions. But when we are using it as Ayurvedic practitioners, we can use see eucalyptus oil to milta hi hai, but we generally don't give it directly for application. We ask them to mix it in coconut oil and then apply. Or अगर steam ले रहे तो put few drops and then take it. It can be added to Searcher, it can be added to OR. So and can be given. त्वचा तेल तीक्ष्ण है, अणु तेल तीक्ष्ण है, so don't mix eucalyptus oil with that. But yes, such combinations can be given. For beauty purposes, Pinda tel, Yeshti Madhu tel, these all I have repeated, sorry, Pinda tel, it should be Naltamaradi tel. So these are for various pigmentary problems that can be used. For Pittajanya Vyadhi, it can be used mixed with Shatadhauta. So there are few combinations that we can prepare in our clinics and give it to the patient. For pains, Narayan tel, Chandan Bala Laksadi tel, Dhanvantaram Sulambu, या कोट्टम चुक्कादी या विषगर्भ, there are multiple combinations. So looking at amavastha, jirnavastha, या other aspects, we can choose the oil, prepare a formula and give it for various applications. We can use it in patra pottali, we can use it in pinda pottali, we can use it in swedan. Yeah, multiple ways we can use this essential oil. For emotional upheaval, if you are using, if you are doing shirodhara, even in shirodhara, you can add this essential oils and then give shirodhara. अश्वत्थपत्र तेल means पिंपळाचं पान, पीपल का पत्ता, उसके पत्ते से सिद्ध तेल. That is what I use in my practice. So yes, I prepare that oil and then use it for shirodhara. Gogruta, Panchagavya Gruta. The list is endless. We all use many combinations in our practice. We can still use many more. But the general rule that we need to know or understand or keep in mind is for sensitive skin, the formula should have 1 to 2%, not beyond that. For skin, body skin, not the facial skin, for the skin, body, and hair use, the formula should not go beyond 2 to 3% of essential oil. And for body rub, for most problems, localized areas, for swelling, for pain, अगर instant usage for shorter duration है, so you can go, the concentration can go up to 3 to 4%, not beyond that. This is something that we need to know. See why I'm giving this precautionary ideas. Or recently I read, uh, I I don't I think I heard this news that a girl was suffering from constant dry cough for 18 months. A girl from Pune, and she was being treated for various allergies, various all the doctors she went. She used to get treatment or relief for few days, and again her cough used to start. No one got the idea why it was happening. Then she went to one another clinic to find one more clinic. There the attending nurse also started coughing. The doctor asked why you are coughing. The nurse said because of the strong smell of the perfume that her mother has put, I am allergic to that smell. And ये समझने के बाद then the doctor asked the mother since when you are using that perfume. And the time duration was almost similar since the time when her coughing started. So just because of some mucolytic irritant, the child was given medication uselessly for 18 months. Sometimes the patient might come for the similar cause. I don't have that type of cough. I'm genuinely getting better from my viral fever. But yes, these are the things that we need to look into. The next slide is my last slide. I'm sharing a pic of my book that was recently published by Ayurvedic Raspit. I have shared a few formulations, ready-made formulations regarding cosmetic usage in this book. So if you wish to go through that, you can um, order it on this website. Thank you once again, Mr. Nanavati, Dr. Snehil, and Dr. Hima Madam, for giving me this opportunity. And if there are any queries, do let me know. Thank you.
Thank you so much, Dr. Kirti. Thanks a lot, Dr. Kirti, for that insightful and enriching presentation. Your expertise and knowledge have helped us all with a deeper understanding on aromatherapy and its clinical use in Ayurvedic practice. And it can be very helpful to all the doctors present here. Before we conclude, I would like to open the session for any questions. Please feel free to raise your hand or type your question in the chat box, and Dr. Kirti will address them. The Q&A is going to be hosted and managed by Dr. Snehal Makwana.
Good evening, everyone. Uh, Thank you, Kirti ma'am, for conducting a beautiful session. Despite you being having a bad throat and cough, you covered each and every point in detail. I just wanted to extend one more thing which we use in our clinic related to aromatherapy, which many of the doctor would not be even aware of. We use aromatherapy in Shirodhara, but our machine is not of oil based. We use a machine which is water based. So it is thermoregulated Shirodhara with aroma oil infused in it. So the machine has the temperature regulation and the timer in the machine. We have purchased this machine from the outside India. One of our colleague, Dr. Satyavati, uses this machine in UK, and through her we have bought two machines, and we use Chirodhara in same manner, and in that we use aromatherapy, all the oils which you mentioned in your slides. So we, according to the condition of the patient, we use those oils for the Shirodhara, and the results are amazing. uh, I would not say as similar as the traditional Shirodhara, because the usage of both the Shirodharas are very different. So I would not compare those outcomes, but the results of this water-based Shirodhara is also amazing. And the effect of aromatherapy we see in that case also. So let's move on to the Q&A. And the first question is from Dr. Anju. Your views on aromatic smell of Amrit Dhara.
Uh, Amrit Dhara is good, but not everybody has the smell, same smell. See, some like, as I said, citrus, some like floral. So if person likes it and can sustain the smell, Amrit Dhara has good use.
Okay. Next is from the Dr. Anju itself. How to combat ugra smell of neem oil for the application.
Neem oil, actually, even Karanja oil for that matter, is very ugra. So we can mix it with some oil which has no smell. It can be til oil, it can be olive oil. Depending upon the prakriti, we can also use this katu tel. So any of these oils can be used, and then you can add essential oils like tea tree oil, which has very good dadrunacha action.
Correct. Okay. Again, same question, same person. Do you incorporate aroma oil by Dr. Urjita Jain?
At the beginning, I used to take from Dr. Urjita Jain's this because the packing is very small. So starting was that, but nowadays I get it from a wholesaler because I need big amounts.
Okay. And any aroma oil used as mosquito repellent other than Karpur?
Yes, I generally mix either Karanja tel or Nimba tel, and all the dandelions that we saw, sunflower oil or dandelion, all have very good impact. Even Jhenducha फूल जे म्हणतो, it has very good mosquito repellent action.
Before moving on to next questions, Anand, I
I'll
will
just add one.
request. Yes, yes,
I'll
ma'am.
just
Yes, sure,
yeah.
ma'am.
My daughter had this project in her NCSE in ninth standard. We had made oil from lantana camera, that is Ugra Gandhi, which is known as Ghaneri in Marathi. So it is roadside plant. We had plucked those flowers and made oil from that, and it has very good mosquito repellent action.
Okay. Before moving on to next question, Anand, I'll request you to unmute, allow Dr. Ashish Padke sir to unmute him. He has raised his hand, so you can meanwhile do that thing. Okay, Dr.
Yeah,
Anju says
Hi,
yes.
Dr. Sneh. Yes. Yeah,
that
it's
was
done.
really nice session. I should congratulate Dr. Kirti, and it's
Thank
really
you, sir.
wonderful because you can see it's not just theoretical, but lot of practical work she has put in, and that is getting reflected. So really very happy to attend. And as usual, she has done sixer, like, earlier I remember she has done well in wound healing. Long back I have heard, but something similar. And I was in travel, but then even then I tried to join, and good that I joined. Coming down
Thank you, sir.
to Dr. Snehil, what said that usually Shirodhara in Taila form, but no, in our college, in Mittal College, we used to give Shirodhara with Kwath also, Mansyadi Kwath, for example. So it can be in Kwath, matlab in water base, oil base, even Takradhara. Takradhara is also quite common. So idea of combination of these would be really interesting, and more specific plant study needs to be done. Like in Tailadhara, in particularly Shirodhara, one of our colleague has worked out on different patterns of waves, which was captured with EEG. So something similar we can think of doing. If, of course, for doing this you require a lot of funding, but we can write and then we can get some funds and go ahead with, and that, I think, that will create evidence base. So thank you very much.
Thank you for
And
this
one more thing, pyrethrum. Pyrethrum is another flower which looks like exactly like Surya Full, but very tiny. And usually you see at the level of hills of Himalayas, Uttarakhand, Himachal Pradesh, तिकडे जास्ती आढळतात. So those particular pyrethrum flower is also proven out to be mosquito repellent. So we can think of converting it into, because I think Odomos and some other products they have used it, but I don't know whether it can be still explored in the form of aroma. Thank you very much.
Thank you.
Thank you, Ashish sir, for your insightful and valuable information which you have shared. Before moving
Thank you,
ahead,
sir.
just check the chat box, everyone. Anand has posted a link towards our spam-free Gyaan Vardhini WhatsApp community, which has all the details of previous and upcoming webinars. Dr. Anju also confirms that they also uses aroma oils for Shirodhara. How to identify the purity of essential oil, ma'am? The question is from Dr. Sarika.
Actually, they have the certificate, and whenever you purchase, they will have a scanner. So they give the origin, they give the source, they give the percentage, even the species is mentioned. So yes, you get need to go into details to see the purity of the product. Only then you will get good results.
And the last question is, do you manufacture aroma oil, ma'am?
No, I don't. Very tedious process, and I manufacture products which are not in the market. Essential oils are available in the market, so I don't go into it.
Okay, so the extension would be of that similar question. Which pharmacy do you prefer?
For aroma oils,
Yes.
essential oils, yeah, I take it from Dawa Bazar. There is this Sri Siddhi aroma oils, so I purchase from there.
Okay. So we purchase aroma oil, if I'm not wrong, from the Neel Kamal. It is in Chembur, I guess. And they also have the aroma oil small bottles. And we purchase aroma oil from them for our Shirodhara purpose. And as you mentioned in your slide, we even have made, as you said, Shatadhaud infused with aroma oil recently.
I have been using Shatadhot in various combinations. Means not only plain Shatadhot. I use Rakta Chandan Shatadhut, I use Amba Haldi Shatadhut. I have prepared Shatadhut from Durvadi Ghuta. So for Durvadi Ghuta, if I add lavender oil, it is excellent for all types of Agni Visarga. So yes, this is something very interesting, and this is not available in market, so I prefer that. I
Yes,
don't
yes,
prefer what is available.
yes, very true. Okay. Please share the contact details of the name of pharmacy. Can you repeat, Anand? Can you type the name if you can?
Sri Siddhi. and Dawa Bazar.
It's three, Siddhi. Okay.
Shri,
Three, right, ma'am? TRI. Three.
Shri.
Shri. Okay, okay. Got it. Yes.
Shri Siddhi. Yeah. Even
Okay,
if
ma'am.
you go online, na, there are few from even. I think there's one government initiative also from Madhya Pradesh. I'm not very sure about that name, but they also prepare lavender oils and all. Just need to check on online.
Okay, okay. Um, Anand, I okay. What's the difference between, last question, ma'am? What is the difference between lavender absolute and lavender French oil? And lavender absolute is more expensive, I think, which can be used for cosmetic purpose.
See, both are from the different species. They are both from the different areas. So yield differs, and hence since the yield is different, percentage of aroma oil yield changes. So as the percentage is lower in absolute, it is more expensive. But it is preferred. See, cosmetic purpose, as we think of in Ayurveda, whatever we eat or whatever we consume, we apply. So same is the case with aroma oils also. Whichever is optimum or best should be used so that it doesn't cause any problems further.
Perfect, perfect. So, Anand, I cannot see more questions in the chat box. You can take over from here now.
Okay. Yeah. Thanks a lot, Dr. Snail. Thank you, Dr. Kirti, again. And so we'll be thanks to everyone who has attended this session today for your active participation and engaging questions. We hope you found this session very valuable and informative. Once again, a very big thanks to Dr. Kirti Deo for sharing her expertise with us today, and thanks to all the participants for joining us. We look forward to seeing you all in our next Gyaan Vardhini session on ophthalmology in general practice by Dr. Rakhi Agarwal, which is scheduled on the 25th of March. We shall be sharing this update in our spam-free Gyaan Vardhini WhatsApp community group as well. Okay, we'll be closing this session now. Thanks again, and I wish all of you to have in having a wonderful evening. Thank you.
Thank you. Thank
Thank you,
you.
ma'am.